It's been exactly 4 years since the World Health Organization declared COVID-19 a global pandemic. So obviously things have changed dramatically in the last 4 years, but now there are updated recommendations on protecting yourself against these kinds of illnesses. Joining us right now to explore the updated approach is Dr. David Pearce, Chief Medical Officer from the City of Houston. Good morning, Dr. Pearce.
Good morning, Haley. How are you?
Good. So the latest information is that the CDC just reduced the time that people need to isolate if they get COVID-19. They reduced that time from staying isolated for 5 days or staying home 5 days down to just 1 day, right? Why is that?
Well, it's kind of down to 1 day. The change is that you can return to your normal activities when two things are occurring. One is that your symptoms are improving, and two, that you've not had fever and there's no cheating. So don't take the acetaminophen, don't take ibuprofen, but no fever for 24 hours. And if those two things, 24 hours of those, then you can return to work. So that could be in as little as 1 day, but chances are there's still going to be a 2-day period for you to notice that you've got improving symptoms and no fever without cheating.
Yeah. Do they still have that masking suggestion that if you still have symptoms or if you're still testing positive to continue wearing a mask?
Yeah. So you don't need to. That's up to you. Remember a couple of things to remember. The simple surgical mask really protects the folks around you. Mm-hmm. The N95 mask is the one that protects you. And to reinforce that, I tell people when you go to the hospital and somebody's being operated on, the surgeon doesn't wear that surgical mask to protect the surgeon from the patient. It's to protect the patient from the surgeon. So if you're going to wear a mask, you really want to wear the N95 mask, to prevent getting sick. Once you're sick, and if you don't want to spread it, then the simple mask is the mask to wear.
Yeah, Dr. Pearce, I mean, you're saying that, and I'm already reflecting on wow, we learned a lot in 4 years, right? I mean, going back to 2020, it actually reminds me of you when I would be reporting on all of the press conferences that you guys were having to basically do daily in the early stages because we didn't know what this was. And I remember even before we knew that it was here in the U.S., I asked you, hey, over in China, they are, putting up tents and doing all this crazy stuff. What's going to happen if it comes here? And you at the time thought that we would be doing the same thing. And it felt like weeks later, I was standing outside of hospitals where we were triaging people. I mean, it all came true, right? So in hindsight, what are some of the big things you think that we've learned since the beginning of the pandemic?
Yeah, that's a great question. And there's a couple of things we've learned. One is the things that we didn't know about the virus that we assumed that turned out to be wrong. So we know about other coronaviruses. There are a handful of them that already exist, right? But when you become ill with those, you don't spread the virus until you develop symptoms. Well, COVID-19 was different. It surprised us so that, you were spreading the virus 2-3 days before you developed symptoms with COVID-19. The other coronaviruses didn't do that. And that's just one example of how this virus acted so very differently than others in its family. And that's what threw us off in the beginning. So, for example, if you get, the common cold, that's a coronavirus. Some of them are coronaviruses. And they pretty much just your sinuses, maybe your throat a little bit. But COVID-19 can impact any organ system in the body. We've not seen a virus that did that before. Mm-hmm. So that's just one example of how. So when you talk about what we've learned, the one thing that I've learned is whatever virus comes along next time, I will make no assumptions about how it's going to behave based on how its brothers and sisters in the same family behave. And we have to take each virus as a completely new Pandora's box of possible problems. That's one thing.
Yeah, which is just fascinating because normally in medicine you can make those assumptions, but COVID, it humbled us all. So what are some of the things that COVID maybe taught us about other respiratory viruses, though? Have you learned any way to better maybe treat other respiratory viruses because of this?
Well, we certainly were able to see the impact of good personal hygiene, right? When we got people, we were bumping elbows and such instead of shaking hands. We saw that you can really slow the spread of a virus by washing your hands, distancing yourself from other people, staying home when you're sick. And the reason I say that is if you notice that in the first couple of years of the pandemic, while COVID was all the rage, we had almost no flu. We had almost no RSV. Yeah. Those usual viruses that time of year, they basically went away. And that wasn't because we had any new weapon against those viruses. What happened was people were washing their hands, distancing themselves, not going to crowded places, and it basically took away all opportunity for the other viruses to spread. So that's one important thing that we learned.
So it basically confirmed that those simple, healthy habits can really save lives.
Yeah, with the other, and I remember while we were doing that, COVID was still a rage, because the difference between COVID and the other viruses, that COVID spread so incredibly easily into a population of people who had no immunity against it, right? So the vaccines weren't available, and even when the vaccines came, there were groups of folks who didn't want to take the vaccine, and so that's the other part that you got to keep in mind.
Dr. Pearce, can I just ask you, like, with the CDC making these updated recommendations, about the isolation period, it kind of sounds like they are making it seem like it is like the other viruses where, if you've been fever-free for a day, you can go back to work. I mean, are we finally at the point where we can say COVID is just like the flu and other cold viruses that you may catch?
I think in some respects you can say that. We now, our population, pretty much everybody has some level of immunity, either through vaccination or through having become ill. So the population now has some protection, kind of like we do with the flu and kind of like what we do with other respiratory viruses, including the cold and such. So to that degree, it's similar. Where it still remains, and probably the other big thing is it's not impacting our hospitals like it was in the last couple of years.
Yeah.
So in those regards, it is. The thing that still worries me about COVID is we still see people dying from it. They tend to still be people with lots of medical problems, and these are, it breaks my heart because these are still preventable, and yet we're still seeing small numbers, but it's still happening.
Yeah, preventable, and you still believe that the most effective way to prevent it is through vaccine?
Yeah, and I'm glad you brought that up, because vaccine is the most reliable way. And let's be realistic about what our expectations should be of vaccines. I think we live in a world where I want to take a pill and the problem completely goes away. That's just not realistic. A vaccine will greatly reduce, but not eliminate, your chances of getting sick. If you've been vaccinated, your level of illness will be much, much less, but you still may get symptoms. And the other thing is that if you're vaccinated, your chances of winding up in the hospital, we know that is tremendously reduced if you've been vaccinated versus if you've been not. So it helps a great deal. The other thing about the vaccine is it doesn't forget, right? Once it trains your immune system is now on guard 24/7, 365. Unlike, washing your hands and covering using a napkin to cover your cough or sneeze, which you might forget. And
right.
So then you run into problems with spreading the virus. Once your immune system's trained, it never forgets. It's on duty 24/7.
Yeah, interesting. All right, Dr. David Pearce, anything else you'd like to say, maybe like where people can get a vaccine?
Yeah, so remember, you can still get vaccinated, and we're not just talking about COVID, but also flu, and for some folks, RSV. You can get those at your neighborhood pharmacies and the grocery store pharmacies. If you don't have an insurance, if your insurance won't cover it, or your health plan won't cover it, you can still reach out to your local health department, the county health departments, as well as the City of Houston Health Department, and we'll help you get it. For the city, people who live within the City of Houston, the Houston Health Department, our phone number is 832-393-4220.
I think some people might still have some confusion because in the beginning, we were getting new vaccines and then you had to go get a new shot. What is the routine now that we should be in? Is this an annual shot now?
It's going to be annual with COVID. It's going to end up being annual. And actually, there are already efforts to combine the COVID with the flu shot, so you only need one injection. So that'll probably come up around next flu season, I would anticipate that. But keeping our fingers crossed, they're going to make it easy for us to get multiple levels of protection with just one shot.
Next flu season, as in this coming fall, the 2024 fall or 2025?
Yes, that's what I mean. This
2024.
Late 2024, right.
Interesting. All right. Well, I'm sure we'll have you back to talk about that then. Thank you so much for our Monday morning chat. We appreciate it.
Okay. Thank you, Haley.